Welcome to this conversation about the Affordable Care Act 6 years after enactment. I'm Karen Davis, the Eugene and Mildred Professor of Health Policy and Management and Director of the Roger C. Lippitt Center on Integrated Healthcare here at the Johns Hopkins Bloomberg School of Public Health. Today we have a very distinguished panel to help us discuss these issues, including Congressman Henry Waxman, Dr. David Blumenthal, Dr. Joshua Sharfstein. This is part of a year-long series of the Johns Hopkins Bloomberg School of Public Health Centennial Health Policy Series. This session, the one today at 12:15, can be seen at jhsph.edu/CPS. So all of the seminars that have been held on a monthly basis are available at that web address. They're archived. We also are using them in a number of our courses. So we're delighted to have you here with us today. A lot of dire predictions were made about the Affordable Care Act when it was enacted. Concerns about the affordability of health insurance, what would happen to people's access to care, what would be the impact on the economy, what would be the impact on jobs, on the federal budget. Certainly, it's still early days. This controversy continues. There are repeated calls and efforts to repeal the Affordable Care Act. But we've had 6 years of experience, and we've learned a lot during that period of time. Today, the President issued a statement about the Affordable Care Act and an accompanying fact sheet that talked about some of the accomplishments of the Affordable Care Act in the first 6 years. It's always hard to disentangle what has happened over those 6 years with what would have happened in any event. We know that the Affordable Care Act came on the heels of the Great Recession. President Obama said that the unemployment rate was down from 10% to 5%. I don't think any of us think all of that was the result of the Affordable Care Act, but part of the general economic recovery. But certainly the dire prediction of a massive loss of jobs has not been borne out. The White House also noted that there have been savings to the federal budget of almost $500 million. So the dire predictions that we couldn't afford this, it would ramp up the federal debt, have not been borne out. But we're fortunate to have an outstanding panel to really help us sort through the impact of the Act, particularly on access to care and affordability of health insurance. They include Dr. David Blumenthal, who is president of the Commonwealth Fund, a nonprofit philanthropy in New York dedicated to improving health system performance. He was formerly director of the National Coordinator of Health Information Technology, which was in fact one of the early pieces of legislation that preceded the Affordable Care Act. He was the Samuel Thayer Professor of Medicine at the Harvard Medical School. He was director of the Jim Mongan Research Institute at the Massachusetts General Hospital. He was the director of information technology for the Partners Health System. He also wrote a book on presidents and health policy, which focused on health policy and politics of previous administrations. He's going to begin today with an overview of some of the facts on the early evidence on affordability. Congressman Henry Waxman is well known to many through his 40 years of service in the U.S. House of Representatives, where he chaired the Energy and Commerce Committee and was the author of numerous pieces of important legislation. It's fair to say that he was a major shaper of the Affordable Care Act. It's often called by some the Obamacare Act. I think many people don't understand how influential members of Congress, Congressman Waxman, Speaker Nancy Pelosi, and others, I think it's fair to say there would not have been an Affordable Care Act without their leadership. So we're delighted to have him here today. He's agreed to serve as the Johns Hopkins Centennial Policy Scholar and has overseen all of these seminars over the preceding months and months to come. And finally on our panel, we have Dr. Josh Sharfstein, who is the Associate Dean of the Johns Hopkins Bloomberg School of Public Health. He was formerly Secretary of Health and Human Mental Hygiene here in the state of Maryland and saw firsthand how the Affordable Care Act affected states. Before that, he was the Principal Deputy of the Food and Drug Administration. He also at one point was a Senior Policy Advisor to Congressman Waxman, but brings his heart and training as a pediatrician, as I would say Dr. Blumenthal, and his training as an internist to these issues. We all care passionately about having a health system that provides the best possible care to Americans. With that, I'll turn it over to you, Dr. Blumenthal.
Thank you, Karen. I'm delighted and honored to be part of this distinguished panel and to be participating in the Johns Hopkins Centennial events, and also to be here on the 6th anniversary of the Affordable Care Act. I'm going to just briefly review some of the major effects of the Affordable Care Act on access to health insurance and access to care, and we can go into further detail as we exchange views. So the Affordable Care Act has quite clearly reduced the proportion and numbers of Americans who lack health insurance, down from a peak of 48.2 million to about 28.6 million. According to these data from the National Health Interview Survey, the administration estimates that about 20 to 21 million Americans have gained health insurance during the time that the Affordable Care Act has been in effect. The result of this has been that more Americans are able to access care without cost being an obstacle. So the proportion of Americans who say that costs have prevented them from getting access to care has gone down from a peak of about 6.9% in 2008 to about 4.6% currently. So that's sort of an influence of the law directly on their ability to get services when they think they need them. If you look at the proportion or numbers of Americans who've actually been touched by the Affordable Care Act and its coverage provisions, it's actually considerably more than 21 million. About 2.3 million young Americans have gotten coverage through the access to their parents' health insurance, which is part of the law. 12.7 million have enrolled in marketplace plans. Those are the most recent data from the administration. These are private individual insurance policies for the most part, or private family policies. About 14 million are enrolled in Medicaid. And if you total all these up, you get close to 30 million Americans who have been directly affected by the law in terms of gaining access to health insurance or purchasing it. And this is probably an underestimate because there are some millions of Americans who have purchased insurance off the exchanges who would not have gotten it because of pre-existing illnesses if it weren't for the Affordable Care Act. Americans who have gotten new coverage are satisfied generally. Well, let me back up and say a lot of Americans who have insurance through the Affordable Care Act will say that they could not have accessed the care they've gotten without the coverage that it provided. So about 62% of those with Medicaid or marketplace coverage who have used their plan said that they would not have previously been able to access or afford care. So this is another example of how, on the ground, the coverage is actually making care available to individuals. There are large deductibles associated with some of the plans, and that's an issue. This is more of a problem for higher income people with coverage through the plan than it is for lower income people. This rather complicated overhead or slide shows you that there is a substantial proportion of Americans who have high deductibles, and that it's a higher proportion for people who have higher incomes and higher proportion for people who have marketplace coverage than those who have employer coverage. So the coverage that's available under the marketplace coverage is not perfect. It's not perfect in the employer world either. And that is an agenda which is currently, that is the availability of more generous coverage, is currently an agenda in the presidential, an issue in the agenda of the presidential campaigns. One of the bottom line things to keep in mind is that adults who are newly enrolled in Marketplace or Medicaid coverage are satisfied with their coverage. So over close to 90% of those with new Medicaid or Marketplace coverage are either very satisfied or somewhat satisfied with their coverage. So this is something that is contributing, at least in the view of those who are receiving it, contributing to the well-being of Americans. I'm going to stop my presentation there and turn it back to Karen.
Good. Well, thank you very much for that. Obviously, this is historic legislation, but Congressman, how would you really think about the Affordable Care Act in the context of all the many pieces of legislation that have been enacted over the last 50, 60 years?
Well, we're celebrating the 50th anniversary of the adoption of Medicare and Medicaid. That was a dramatic step forward, and this, I think, falls right behind those two programs in terms of its historical context of assuring all Americans health care coverage. Before this law was adopted, and I think we need to keep this in mind, we had so many millions of people who couldn't even buy health insurance because they had pre-existing medical conditions. So even if they had the money, they often didn't even have it afforded to them, the opportunity to buy it, or it was that the costs were so extreme that they just couldn't buy it at all. And we had people who just couldn't afford health insurance. So the first purpose of the law was to stop the discrimination by the insurance companies that kept so many people from getting access to insurance coverage, and to help those people who wanted to get the coverage but couldn't afford it, so we gave them tax breaks to do it. We built on the existing system, and the existing system is primarily the system we've had since World War II, where most people get their coverage through their jobs. Others get their coverage through Medicare or Medicaid already, and we left those alone, although we made some improvements. But to cover those people who didn't have coverage, we set up an exchange where people could choose between different health care plans that were competing with each other that met the same standards, and then people could buy the plan that would fit within their needs.
Well, I think it's important to remind people of what we had before the Affordable Care Act, and as you say, exclusion because of pre-existing conditions was a major issue. And we also saw an increase in the uninsured from 38 million to 48 million in that decade before enactment. So the trends were definitely going in the wrong direction.
As well as the cost trends.
As well as the costs, the premiums, double-digit rates of increase. Dr. Blumenthal, you studied previous presidents. Obviously, a lot of presidents tried to make this happen over the 20th century. President Nixon, Carter, and President Clinton, predominantly among those.
And Truman.
But why did President Obama succeed when these other presidents weren't able to make that happen?
That's a great question, and I think that it had a lot to do with the wisdom that had been gained through previous failures. So one of the things he did, which, for example, President Clinton did not do, is he entrusted a lot of the initiative to Congressman Waxman and to his colleagues on the Senate side to let the Congress craft the details of the legislation. He presented only general principles. He didn't present a finished piece of legislation, and that was very important. He also, because he didn't have to draft the new legislation, he was able to begin the process with Congressman Waxman's help and the Congress's help quickly after he became president. And so he was still fresh in office. He still had a lot of political capital. He didn't delay it the way President Clinton had done. And he learned both those lessons from the failure of the Clinton effort. And then I think that he and others had learned that they needed to take the current system as it was and not try to reform everything, but to focus on the gaps, the people who didn't have coverage, rather than changing the lives of people who already did. Because in the previous efforts, the anxiety created by attempts to change the private system as it existed created an enormous opposition and uncertainty. So I think those were among the key lessons. So he learned a lot, and the people who worked for him, including his chief of staff, Rahm Emanuel, who had lived through some of these previous episodes, had learned a lot. And it's nice to see people learning from experience. It doesn't always happen in our political lives. He also, I think, had, as a president, the judgment to stay out of the details and to focus on the politics and to focus on the leadership issue rather than on the very specific crafting of details, which I think other presidents, including President Clinton, have failed to do.
So 45 years from Medicare and Medicaid enactment to now the Affordable Care Act. But obviously there were efforts, even if presidents did fail with ambitious universal health insurance, important steps that were made. I think particularly Congressman Waxman at the expansion of Medicaid to low-income children and pregnant women starting in the late 80s, early 90s. Obviously, the enactment of the Children's Health Insurance Program in 1997. States stepped up to the plate in many instances to really deal with the dire situation, the uninsured. But what would you say in that interim period we were able to accomplish on at least some modest efforts to improve access and affordability?
Well, I think that expanding the Medicaid program made a huge difference, and getting children covered, not just those below the poverty level, but those above as well, at the state action. It covered more people. People could ask us, was that the ideal? People can ask us now, was the Affordable Care Act the ideal? Well, there's not an ideal that we could put on the table and pass, but we could build on what we had and understand that every step that we took meant a great deal in the lives of people who otherwise wouldn't get coverage. But I think that I give a lot of credit to President Obama himself, because it was rough. It was a rough going. And there were people in his own administration who were saying, forget it, you're a new president, don't try to do everything, just do something for kids beyond what we already had. Just do the best you can, but don't be so ambitious. But every report that I had and every time that I saw the president, he said, no, I want to get this done. He was committed to it. And he was very fortunate to have Nancy Pelosi as the Speaker of the House and Harry Reid as the President of the Senate. The administration also did something that was helpful to them. I think they did a little bit more than that I would have liked, but they worked with the stakeholders. They worked with the hospitals, they worked with the doctors, they especially worked with the pharmaceutical companies. And rather than have all of those, and the insurance companies, have all those groups go out and oppose it, he tried to explain to them that this was going to build on the existing system. They were going to get a lot of new customers, so to speak, and try to bring them along. I certainly have a regret of how much we gave up to the pharmaceutical industry, because there were things that we could have done that we're now paying a price for not doing in the concerns that are real about the ever-increasing high price of drugs, which is pricing out not just individuals, but the Medicare and Medicaid system as some of these brand new products come on the market. But the decision was made to try to bring in as many people as possible, and that, in retrospect, that decision served the president well.
Well, you note the point that the Affordable Care Act didn't have the federal government negotiating pharmaceutical prices. What was the basis of excluding that from the legislation?
Well, we had already had Medicare Part D adopted by the Congress. It was adopted in a version that was advanced by the Republicans. And what they did in their Part D coverage for the Medicare program was to say we'd have private insurance companies running it, not as a benefit for Medicare, as we've already seen for doctors and hospitals and other providers. And they wrote in that law there could be no negotiation for the price of pharmaceuticals. Even though we were bringing in millions of new people together to buy these drugs, we should have gotten discounts on those drugs. Instead, it was left to the pharmaceutical benefit managers of the plans to do the best they could to negotiate those prices. We lost that opportunity in Medicare Part D. the pharmaceutical industry was a very, and is a very powerful force in Congress. The administration didn't want to take them on this issue, and so they didn't insist that we negotiate prices with them, but and they had other concessions that I thought were completely inappropriate, especially for people who are on Medicaid and they got a discount for the drugs and they were switched over to Medicare so that they were, pharmaceutical companies were paid a much higher price for their drugs. We try to correct that issue. But I think the president realized that was a bridge too far, and he knew that he was working on very narrow margins in the House and particularly in the Senate to get the bill passed.
I would add, I think that's a very good point. Even with learning the lessons of history and all the different concessions that were made, the bill barely passed. I mean, it was touch and go. I don't know very many people who had a strong sense of confidence throughout the whole process, and it really showed just what an enormous challenge it is to bring a solution to some of the biggest access problems in healthcare to actually be implemented. And the fact that it happened is, a pretty remarkable achievement in the context of history. I do think one of the things that contributed to it relates to the states, because the states were feeling a lot of pressure around healthcare and had opportunities through some of the different federal programs that allowed states to expand healthcare coverage to do some innovative things. Massachusetts did its healthcare reform. Hawaii had a healthcare reform. There were a number of states that were expanding Medicaid for different populations, including my state of Maryland, where the governor took a lot of pride in expanding to parents of kids in the CHIP program. And so it became an issue for a number of states, either because of the benefits of getting more people insured or because of concerns about rising costs in the private sector and in Medicaid. Those things made healthcare a state issue, and I think that by and large the way the bill was designed was pretty favorable to states and was able to kind of walk a narrow path with respecting kind of the historic role of states in the healthcare market.
And obviously the intention was that the federal government would largely pay for expanding the Medicaid program to cover everyone below about 133, 138% of poverty. What wasn't anticipated was the Supreme Court ruling that effectively made it optional for states to expand Medicaid.
Well, and I think, to be fair, what also wasn't anticipated was just the intensity of the backlash against that provision, because it was an unbelievably positive deal. And at the time I was a health secretary, and I did some hearings with some of the red state health secretaries who were trying to explain how in the end it could cost people more. And if we did an analysis in Maryland that if you just looked at the tax benefits alone of that kind of federal money coming into the state, it swamped the state contribution. It was, and I almost felt at one point like, if you just basically buried the state contribution and the federal money came in, you didn't spend it for healthcare. You just did something else with it. It would be a great deal for states, but you're actually insuring people. And so I'd be interested in what you all think of that. But from my perspective, it was just very puzzling that, and a little bit unanticipated that a program like that was such a federal match would be so heavily resisted by states. That, to me, then once that happened, I think that set in motion some of the issues that happened with the Supreme Court. But the fact that essentially governors were willing to turn their back on, and still are, a huge amount of money to really help not only their most impoverished citizens, but also really support their safety net institutions and academic centers and others who depend on who provide the clinical care was pretty surprising, at least to
Well, we
me.
never anticipated that the states would have a role to play where they could stop some of the law from going into effect, but it was the court decision that said that states had a choice of whether they were going to take the expansion of the Medicaid program above just those who were below the poverty line and get more people into the Medicaid coverage. And the deal was a terrific one for the states because the federal government was going to pay 100% of the costs to cover these people for a good number of years, and then it was going to drop to 95.
Mm-hmm.
So it's the kind of deal that you would think no reasonable governor or state legislature would turn down. But we didn't anticipate they would have the choice. It was because of the court decision, and then because the law had become so politicized that a lot of Republican governors felt that they were disloyal to their Republican ideology if they expanded the Medicaid program, which meant they disregarded the fact that low-income people went without coverage. Their hospitals had to absorb the cost of uncompensated care when people ended up in the emergency rooms, and there was a loss to their economic well-being. I think that's the reason why most, if not all, the states are going to eventually pick up the Medicaid expansion, but they have not all done it yet. As far as the exchanges, the states had the option to set up the marketplace, but not all of them chose that, but we had a federal backup. And so even a governor in a state that didn't really want to have anything to do with this program couldn't just say, we're not going to allow people to go out and buy private insurance through the marketplace, through the exchange. That was going to be set up and was going to be running. That became an issue indirectly with the Supreme Court. We survived that challenge. But the states couldn't say, no, we won't have it in our state. But they were given the option to say no for the Medicaid expansion, which we never anticipated in Congress.
And obviously there were Republican governors that proposed expanding and made that happen. I think particularly of Governor Brewer in Arizona. And she pointed to the fact we're paying taxes in any event, and this is going to create jobs in our state. We'll have less bad debt for our hospitals. It's good for our economy. We should take advantage of it. Governor Kasich in Ohio stressed more the importance of the Affordable Care Act for making sure that very vulnerable populations could get care, whether that was mental illness or disability or serious illness like cancer. But what's your sense? Do you agree that most states will eventually take advantage of this provision?
I do, although I think that what, from a big picture standpoint, it really shows is how different the politics of providing care and coverage to the poor are than it is to the middle income people. And that was reflected in the Medicaid expansion. It was reflected in kind of the panic over that second Supreme Court decision that was out there. If suddenly all these exchanges would be shut down in these states, what would happen to the people? There was a lot more talk about that than what was actually happening to the people in states where Medicaid wasn't expanded. There was a lot more focus on whether the exchanges were working. It's important that the exchanges work, but a lot more focus on whether the Medicaid expansion was actually working and how those systems were going. And so I do think that it's such a good economic deal, and it's very important to hospitals, particularly in a lot of states, that over time, even people who may not have the top priority on low-income populations will see the value in doing it. But one of the more jarring or more difficult to swallow things about how the Affordable Care Act has progressed is just how the Medicaid discussion seems to operate at a different level to me than the other parts of it.
We forget that it took almost 20 years for the last state to adopt the original Medicaid program, and 5 or 10 years for the majority of states, or the great majority of states, to adopt it when it was passed 50 years ago in 1965. And it's also true that a number of states are beginning to adopt it by putting a conservative flavor and their own ideological imprint on the program. And Arkansas was the first to do that. About 6 or 7 states have done it, and our work shows that, in fact, at least in Arkansas, the effects on coverage have been positive. So you can't distinguish between the state modified Medicaid program and the Medicaid program created by the Congress in terms of the quality of the coverage that people are getting. So that's a positive. But I also feel that there has been terrific opposition to the the non-Medicaid portions of the law, as witnessed by the local governments, state governments' efforts to impede enrollment in the federal marketplaces. So I think that there's a politics for the poor, but there's also a politics for low and moderate income Americans, which is disconnected from in which politics and the interests of populations seem to be disconnected in a strange way. And that it may be some of what's playing out in the current election as well. The disconnection between the core interests of large numbers of Americans and the politicians who claim to represent those interests.
Let me ask you this question on that. How well do you think people who have benefited from the Affordable Care Act appreciate that it was the Affordable Care Act that benefited them?
I think it's very mixed and certainly far less than you would expect. I do think, though, that Americans were some of the proposals to repeal the law, were they to go into effect, there would be, by some estimates, a loss of in excess of 20 million people losing insurance. And I think that would create a huge outcry. So people react differently to gaining something than they do to losing something. And the prospect of loss would, I think, have a major political effect.
But there's a real disconnect that people have. For example, a lot of the people that opposed the Affordable Care Act said, I don't want government-run health care. Leave my Medicare alone, which of course is a government-run program. But I think this argument about Medicaid underscores something that I feel very strongly about. Over the years, I've heard Republicans say, we shouldn't get a program that covers everybody. We should only put our focus on the people who can't afford it, the low-income people. Because others that can afford it, why spend the money on them? But the genius of Social Security, Medicare, and now the Affordable Care Act is that everybody gets protected. Because we've seen what happens when we leave it only for a program for low-income people. The governors don't care about them if they're Republicans. Unfortunately, they may feel some sympathy if they ran into an individual whose family was suffering catastrophic health problems but didn't have health insurance. They might say, that's terrible, we got to do something like let them buy a cheap plan from another state. But the reality is that there's a lot of indifference when it's poor people being affected. So when they say make it a poor people's only program, those are the programs that are cut or not picked up on by the Republican governors.
And certainly there was a lot of concern that seniors would be adversely affected by the Affordable Care Act, that they were taking their Medicare money and using it to pay for coverage of the uninsured. And I wonder now whether there's any better understanding of what the benefits of the Affordable Care Act were for people on Medicare.
Well, first of all, there's been no adverse effect on seniors. There's been no deterioration in their access to care. And as a matter of fact, the law actually has had benefits for seniors in terms of guaranteeing them access to preventive services and reducing their exposure to pharmaceutical expenditures. However, I would wager that very few seniors appreciate and understand that. Yeah. So that's another problem that the law has faced politically since its enactment, which is that some of the benefits are so complicated and so surrounded by other phenomena that it's very hard for people to discern their true effects. And when you actually sit down and explain to people the details of the law, they're often incredibly surprised and astounded that they don't already know this, because it's very complicated and the media has focused on the coverage fights rather than on all the other less prominent provisions of the law.
If you ask people, do you favor Obamacare, there's support, but a lot less than if you ask them, do you support the Affordable Care Act? Oh yes, I support the Affordable Care Act. But even if they oppose it, you ask them, do you think that the insurance company should be prevented from discriminating? Oh yes. Do you think your children should stay on that parent's plan until their age of 26? Oh, that's great. Do you think that people ought to be able to buy individual insurance policies if they don't have a policy at their job? Because we are talking about people who pretty much are working that get access to health insurance. They favor that every step of the way, every part of the law. It has very high favorable ratings. But then if you ask them about the whole law, then the unceasing propaganda against this law has taken its toll on how people view it.
And I think there are a lot of provisions of the law that people don't know about, whether it's calorie counts on menus or certainly the attempt to improve access to a family doctor, to improve quality of care. What would you say more generally the effect of the Affordable Care Act has been on the way the whole healthcare system operates, the quality of care for all Americans?
So that's a great question, and it's one of the most overlooked aspects of the law. The law really has two big parts. One is the coverage part, which has gotten 99.9% of the attention. But the other is a delivery system reform part, and the Congress, in its crafting of the law, was extremely wise in injecting all kinds of options for changing the way the delivery system works. Probably the most important of which has been a very important emphasis on paying for value rather than paying for volume in healthcare. And as someone who circulates in the healthcare system to try to understand it, I'm impressed with the extent to which those provisions have created turbulence and uncertainty in a positive way and forced big healthcare systems to re-examine how they do business, to reorganize and to prepare for change that is, I think, constructive. So they are thinking much more about the populations they serve rather than just the patients they take care of. Thinking much more about how to avoid unnecessary expenditures, unnecessary care than they did before. Thinking much more about what the future of the healthcare system should look like in the most basic way, and what their accountabilities are and what their responsibilities are to their patients and to the public. And that change, which is always difficult, has created opportunities for creative innovation that I don't think we've seen since the passage of Medicare and Medicaid.
And certainly the health system, in terms of its use of modern information systems, electronic medical records, is a major change. And I know the American Recovery and Reinvestment Act that President Obama put forward to deal with a great recession that he inherited also had important provisions that you oversaw for the first 2 years of the Obama administration. But how would you say that has affected the way Americans get care?
So I had the privilege of working for the president to implement an effort to basically wire the U.S. healthcare system. The U.S. healthcare system has been very, very slow to take advantage of the information revolution that has transformed all our lives in so many ways. When I began working for the president in 2009, only about 17% of American physicians had electronic health records and only about 10% of hospitals. Now we are up to about 90% of hospitals and about 70% of physicians. So basically we have now a wired healthcare system, and the benefits of that will be realized over the next multiple decades. People's health information is digitized, which means it can move. It's not moving yet because there are both technical and economic and structural barriers to that, but we will overcome those, and once we do, we will see an enormous transformation in health and healthcare, because information is the core resource of care. As a physician, I can tell you that deprived of the information that I have in a patient's record, I am helpless to provide good treatment to that patient. But with good information, I'm much more empowered. And that is what we're talking about here. It's about sort of a fundamental resource in care. And having it digitized is a big step forward.
When I was the secretary of the Maryland Health Department, I was talking to hospitals and doctors when these provisions were getting implemented, and I met doctors who were just amazed. In Maryland, you can get doctors can get access to records from other hospitals in an emergency situation, for example. And people told me the very moment they turned it on, from that very moment, they were able to figure out important medical issues for patients. It really made a difference, and they just loved it right away. People don't love everything that's going on in healthcare, believe me, but when we talked about the system of sharing information and being able to help your patients, doctors really appreciated that. And I think one of the interesting aspects of the law is, and I said I was maybe disappointed with some of the politics, but you flip the coin to some of these other aspects of the Affordable Care Act and how care has changed. And there's been a surprising positive amount of bipartisan agreement. in the changes in healthcare. And you see it in red states as well as in blue states, people thinking that, maybe it's not a great idea that we just keep paying for every procedure because maybe we'll be getting a lot of them that aren't needed and people could get harmed, and let's think of a better way to pay. That isn't so much a partisan idea at all. And the Affordable Care Act's made a huge shift in people's thinking about that, kind of below the political radar. So maybe you've got the access part overly politicized, and this other part pleasantly, I think really hasn't been, and it's made a big impact. In Maryland, we were able to change the way that hospitals are paid across all payers to really align the incentives of hospital payment with the health of their communities in a different way. Hospitals do better financially when there are fewer preventable illnesses in their community, which is a pretty great thing if you think about wanting a community that's healthy. And how to get that to work, there are a lot of details, but all that was made possible by the flexibility and the forward-thinking part of the Affordable Care Act on how healthcare is actually delivered.
At our first session of these centennial meetings, we talked about Medicare. And you made the point how Medicare, when it was adopted, had explicit language. This is not supposed to change the way medical care is delivered. It was simply a way to cover mainly seniors. But when the Affordable Care Act was adopted, it clearly was not just to cover the uninsured, but to change the health care for everybody. So where we used to have Medicare doing things that the private sector would pick up for their insurance coverage, we now have all insurance and all health care being transformed through this law to pay not just for fee-for-service quantity of care, but to pay for quality of care, to organize the delivery of care in a more comprehensive, rational way. The benefits of this law are going to continue for some period of time as we see healthcare changed. And someday we may see that there's not that much of a difference between whether you have coverage through Medicare or coverage through your job's insurance or for the individual insurance, because one will have a minimum benefit that's written into the law, will have a better delivery of the care, a less costly delivery of the care than otherwise would be the case. So this is a transformative piece of legislation.
And certainly one specific example of that is the provision that there should be, all preventive services approved by the U.S. Preventive Services Task Force should be available to everybody without a financial barrier to care, without a deductible. Or
It's really changed the discussion on prevention as well as the realization of about disparities that exist. There are a lot of aspects to the Affordable Care Act that people don't appreciate. And one of the things I would say is that these other aspects, the below the radar screen aspects, may be more important for the long-term success of the healthcare system and the law, even than what's happening with coverage rates today. Because the issue that Dr. Blumenthal mentioned about the high deductible plans, which is a big threat to health insurance in both the public and private system, the employer base, that reflects the increasing cost of healthcare. And if the cost of healthcare can't be brought under control, there's a lot of deck chairs on the Titanic. I mean, you can move it to deductible, you can move it to premium, you can use public subsidies, but the taxpayers are paying for it. It's just really hard to think about what to do if healthcare continues to consume a greater share of national resources. And so all these other things are aiming to basically control costs while improving outcomes and quality at the same time. If those are successful, the country has a lot of different options on how to, continue to move forward. If those aren't successful, it's really hard to imagine under any system how to continue to be able to provide a quality insurance and, more importantly, quality coverage and care.
yeah, it's interesting to see what the future will hold, and obviously a lot of variables will affect that. But one that's always there is the pressure of the federal government to cut, find savings. So I'm sure there'll be pressure over time to trim back, even though all of us understand there are areas that we ought to be investing more, whether it's prevention and public health or improving the network of hospitals and doctors that people can see, or making sure those deductibles are affordable. But what's your view about the more vulnerable provisions of the Affordable Care Act, particularly in an era of ongoing budget issues and concerns?
Well, it's not just the budget issues, but the ideological ones, because every candidate for president on the Republican side started off with they want to get rid of Obamacare. Now, I don't think they can repeal this law, but there are areas that are vulnerable, and of course the vulnerable are always the lower income. They could do things in the Medicaid program, like set it up as a block grant and tell the states, here's some money. If you can't afford to do everything for everybody, just do what you can and that's it. We won't ask anything more of you. Even Republicans, some Republicans are saying that we ought to change the Medicare program and make it a voucher where people would get a certain amount of money to spend to go buy private insurance. Well, private insurance is not fighting with each other. Private insurance companies are fighting with each other to cover 85-year-old women who can't afford anything other than what they get under the Medicare program. And you'll have very much of a tiered system rather than a uniform system that's fair to everybody under Medicare. So there are things that I worry about, but I think that Dr. Sharfstein's point about being able to hold down healthcare costs is a key one, because otherwise most of the proposals we see when they talk about budget savings are not really savings, they're shifting costs. So rather than having Medicare pay for costs or Medicaid or any other program, they'll simply say, well, have the individual insured have more skin in the game, which is the expression you hear over and over again, make them come up with more money. Well, that just isn't going to happen for a lot of people who can't afford it, especially if they're paying for their premiums and other expenses. So we'll see how this plays out. There'll be budgetary pressures, but they're ideological pressures for those who really don't want the role the government has played in Medicare or Social Security, Medicaid, and now the Affordable Care Act. They expect to roll it all back.
Well, I think that ideology revolves a bit around the role of the market versus the role of government. And as you say, about 10 million Medicare beneficiaries are either in nursing homes or they have some condition like Alzheimer's or other forms of dementia, or they're in wheelchairs, and you don't see too many insurance salespeople walking up to them and convincing them that they've got the better product to help them
Well,
with
the market has a role to play, but we got to make it fair, where people are actually buying what they need through the market. And that's one of the reasons in the Affordable Care Act we limited the amount of overhead for the insurance companies, because they could just pad the overhead and pass it on to their premiums. Well, we said, no, you can't do an insurance that costs more than 15% overhead costs. Now compare that, of course, to Medicare. What is it, 2 or 3% overhead cost? It's a lot of money, but at least it's not the amount of money that the insurance companies have been able to get away with.
I'm actually encouraged at the progress we're making in providing good care and cost-effective care for the sickest of the sick. And I think the Affordable Care Act has played a role in creating and promoting those experiments that are going to make it feasible for insurance companies, if they want to care for those very, very ill Medicare and other patients. The Independence at Home experiment that is proving effective, part of the Affordable Care Act, which provides very intensive care in the home to substitute for nursing home and more expensive institutional care, has been positive. And I expect that as part of the payment reforms that are going on under the Affordable Care Act, that is the changes in the way providers are paid, that providers are going to be encouraged to find better ways to care for the sickest patients that will make them much more affordable to care for society. So we are seeing, I think, in both the private sector and in the public sector, innovation promoted by the system reforms of the Affordable Care Act that are going to make care better for everybody, and even the ones who are most at risk in our current healthcare system.
And obviously the law was designed to deal with the worst problems out there, but I know you were conscious of a budget ceiling on what you could afford to do in the Affordable Care Act, and the benefits are called different tiers, a bronze plan or a silver plan or a gold plan or platinum plan. Dr. Blumenthal mentioned that for lower income people, some of those deductibles you provided subsidies, but still I don't think most people realize people don't have savings that they can afford to spend $3,000 every year on their healthcare expenses. It's certainly at the lower tiers, the bronze plans, even the silver plans, some of those deductibles may be beyond the reach of families, particularly those who have an illness that every year they're going to need a lot of care. What can be done about improving the benefits?
Well, there are a number of changes we need to think through to the Affordable Care Act, but we've been unable to do it because any proposal, even to correct errors in the statute, have been blocked by those who say the only thing they'll pass is a repeal. But we've got to look at that issue of the high deductibles. There's a glitch in the law for families, an interpretation we never expected, where if the husband has a job and he's offered insurance for himself that's affordable, he has to take that insurance, even though the insurance may not cover the rest of the family. Well, it may be better for him to go to the exchange and buy an insurance plan for the whole family, but he's prohibited from doing that based on the Department of Treasury interpretation. That I would like to have us fixed. And we've got to do something about the high cost of drugs. We can't just sustain a program where we're trying to hold down healthcare costs everywhere, but we leave it wide open for the pharmaceutical industry to charge the monopoly price that we give them as an incentive to develop new pharmaceuticals. We want them to have the incentive, but we've got to have some restraint on costs that are simply unaffordable. So there are issues that we're going to have to deal with, and I'm hopeful after this next election people won't be taking that hard position about the law, but try to recognize this is the law. What can we do to make it work better?
And certainly the presidential candidates have put forward some ideas about what they would do. Secretary Clinton has talked a lot about improving the Affordable Care Act, supporting it, but looking at things like the family glitch, about the amount people are paying out of pocket every month for prescription drugs, and dealing with that. Senator Sanders is more ambitious and talking about Medicare for all. Mr. Trump is looking at repealing the Affordable Care Act and letting people buy health insurance in any state, including maybe buying your health insurance in Alabama where it's cheaper. So they're very different kinds of solutions that these candidates are putting forward. What do you think is the most likely or most feasible direction to go, or what do you think of those different alternatives that have been put forward?
Well, I don't think that Donald Trump has thought through the consequences of his proposal. His idea is, oh, you can buy a cheaper policy somewhere else, go ahead and buy it. But if you don't have standards, people can end up buying a policy that's just not going to recover what they need when they need it. And especially if states are trying to make sure that their citizens are protected with genuine insurance coverage that will be adequate. If somebody in the state could go buy a policy in Alabama, for example, or Mississippi, that's a lot less than that. You're driving down the insurance coverage for everybody in the country, and it doesn't solve these other problems of people who are discriminated against by insurance companies or can't afford it, which would be gone if he gets his way. Senator Sanders, there's a lot to say for the idea of a single payer system or Medicare for everyone, and President Obama made statements during the legislative process that he might like that idea, but there was no way in the world that we could have passed it. We barely passed the Affordable Care Act, and it would seem to me that we ought to build on this law rather than think we're going to replace it with something so radical, as desirable as it may be, but very radical. So the president would be using all of his power as a new president, where the opportunity is greatest to pass dramatic legislation, to go back and revisit this issue when we have so many other issues that we have to deal with. I think it's Senator Sanders, a false promise to people of an ideal that we're not ready to get to in a single step. I like what Secretary Clinton is proposing. We ought to build on the system and make it better, and I think that'll have the opportunity to do the most good for people.
Dr. Blumenthal, any thoughts about the presidential election and the different
Well,
options?
Karen,
on the-
as you well know, I work for a nonpartisan 501c3 organization, so we don't take positions in the presidential races.
I didn't take a position. I only outlined,
Well, I didn't say you had.
of the three, there's only one that has anything good to say that's realistic. And that's the one I'm for. But I don't work for a nonpartisan organization.
So, I think we can all learn from history. And Congressman Waxman actually, at an earlier time in his career, supported a very, very comprehensive universal coverage proposal. And that was a mainstream Democratic proposal. It was part of the platform planks of virtually every Democratic presidential candidate from President Truman until after President Clinton's failed effort to pass the law. After that very chastening experience for Democrats, because keep in mind that President Clinton was in the White House, but his party also controlled the House and the Senate at the time when he tried to pass a very comprehensive coverage law. And he failed embarrassingly and in a way that made it very hard even for Democrats to advocate the kind of law that Senator Sanders now advocates, which would have been mainstream Democratic policy before 1992. So what I think has been learned is that we are not inherently a very liberal, left-leaning country when it comes to social policy and government role in society, and that we do things incrementally, and we answer the needs of people who need things the most, and that's what we've done with the Affordable Care Act. As a practical matter, as a commentary on what we are capable of doing as a country, it seems to me the Affordable Care Act stretched the limits of what we can do and what we will allow collectively government to do in our lives. And it would not be feasible to do a Medicare for all kind of proposals, even though many would see that as a very rational approach, and even though most other countries of our wealth and that are democratic and capitalistic have done something like that. So I guess I find myself agreeing with Congressman Waxman and his perspective, but arguing it from a historical standpoint.
Well, as a young man, you worked for Senator Kennedy during, I think, it was the Carter years.
That's right.
And Senator Kennedy was the leading advocate in the Congress for the national health insurance system. And it was the Kennedy Corman, the Kennedy Griffiths, and at one time it was the Kennedy Waxman law
right?
proposal.
Right,
And, but it was called the Waxman-Kennedy bill by my mother.
Dr. Sharfstein, you're an academic now, not a politician or a political figure. What's your view about what we should do going forward?
I think one of the interesting things about the Affordable Care Act is that it actually does set up the possibility of very dramatic change in healthcare delivery, even if it doesn't, create a single payer system for payment. But if you look at what Maryland's done for hospitals, what Vermont is considering, all payer accountable care organization, what a number of states, Arkansas has done on bundle payments across payers. There's a lot of flexibility for states to do things very differently, and because there's bipartisan interest in getting better value, I think that's extremely promising. And if you take a step back from the day-to-day politics of that, I think that there's a lot that can be done. And from my perspective in public health, I think it's great to make healthcare higher quality. I totally support that. It needs to be higher quality. It's great to be able to make sure people have access to it. But what's super great is if healthcare is oriented towards prevention so people don't get sick in the first place. And if you just change the payment, but you're still paying fee-for-service and everybody needs to do a lot of procedures and there's not a big focus on prevention, then you've accomplished some things. But you haven't accomplished what I think is the greatest opportunity for health, which is to take all the money and strength and know-how and innovation in healthcare and orient it towards prevention. So people can really live the lives that they want to live, and that's really what public health's about. And I think the Affordable Care Act really sets up some opportunities for radical change in that regard below the political radar screen. And I think those kinds of experiments are going to increasingly happen around the country, and I think that's something to watch when you're sick and tired of watching the presidential debates.
Well, thank you for this great conversation. I think we've reminded ourselves about what the health system looked like before enactment of the Affordable Care Act, rising numbers of uninsured, rising premiums, exclusion of people who couldn't get health insurance on any terms because of pre-existing condition. And we've seen the difference the Affordable Care Act has made. We've seen the increase in health insurance coverage, dramatic reduction in the numbers of uninsured, improved access to care. We found healthcare costs going up the slowest rate in 50 years. No adverse effect on the economy. In fact, a positive effect on the economy in terms of jobs and reduced debt of hospitals, and certainly a favorable impact on people's ability to get the care they need. Certainly, there are going to be challenges going forward. There's a need to build on, but also improve the Affordable Care Act. It doesn't address certain issues, such as the rapid rise in pharmaceutical prices, particularly for specialty drugs that we've seen of late. It doesn't really address the problems of an aging America, where people prefer to live independently at home and want to have help at home to maintain that independence. So a lot of challenges ahead. Fortunately, the Affordable Care Act invested $10 billion in innovation and looking at what works and what would improve our health system going forward. And we need to really follow that and, again, invest it, as those of us in public health are trained to do, with analyzing what's promising, what's proven, what can improve outcomes for all Americans. So thank you very much for being with us. I hope you will rejoin us at 12:15, where we're going to have a distinguished panel, including some of the luminaries who were instrumental in shaping the Affordable Care Act legislation. So you can do that at jhsph.edu/CPS, and you can also obtain access to our previous Centennial Policy Series overseen by Congressman Waxman, and a few more in the months to come. Thank you very much.